This concept of cord blood banking, which is done in an autologous manner to treat certain diseases which are directly applicable for the child's life in future. For example, you can take his cord blood, his or her cord blood, and use it for a spinal cord injury which he may or may not be in that position later in life. And for that you have to make sure that these cells are actually going to become a neuronal cell when they are in that environment. So in the same respect, you can take these cells and treat a hepatic disorder or a kidney disorder or diabetes or diabetic foot ulcers which come with diabetes, or diabetic neuropathies, diabetic nephropathies, or even Parkinson's, Alzheimer's. So the procedures are fairly simple and standardized now. As a company, we have franchisees all over the country, and we are able to deliver the stem cells, collect it and deliver it to us within a span of 24 hours. So when the mother is interested or she wishes to bank, she can call up our representative or look up our web page, and during the time of delivery, basically the child, after the child is born, before the placenta is expelled, you collect the cord blood. Typically around 100 to 120 ml is the optimal amount collected. So we have sterile devices wherein the sample is collected and the cord is also collected. Both of it are transported back into our lab, our CGMP facility, and then the process of cord blood collection, the banking begins. And the first thing we will do is make sure that the infectious diseases screening is done. The patient or the client is cleared of all the infectious diseases. That is a mandatory SOP we have. Then the sample goes into the clean room, and once the CGMP facility is geared to do this kind of work, and the processing starts. After the processing is over, we enrich stem cells, and these stem cells are then banked in long-term storage devices, which is basically in liquid nitrogen vapors at -196 degrees, and they stay there till the patient requires. The ICMR themselves say that cord blood banking is permissible. So there is no problem in banking autologous. So if you bank autologous stem cells for the child, it's perfectly legal. And the mother, like I said, has the ultimate right for the child's cord blood stem cells till the child attains an age of 21 years. At the age of 21 years, the child is having his rights. He can exercise it in terms of using it for himself or donating it or keep it going for some more time. So we've had